We are connected.
All right, good evening, everyone. This is Dr. Schilling from Sequoia Health, bringing this week's Wednesday Wellness Minutes. And this evening, we're going to focus on what's called a Watch Me Do video. People like to see things and how they're done rather than just hear me blab and talk and things like that. So rather than doing the talking head, I'm going to do a Watch Me Do. This evening, we have our lovely Melissa here, our team member, and she happens to have, well, shall I allow you to explain it?
Some burping, gas, bloating issues.
There you
that
go.
I've been dealing with.
Always fun for everybody.
Yeah.
Family fun. No, not really. But what are you working on right now for your immune system?
So right now I'm working through H. pylori, a series.
Okay. So one of the serious symptom relief therapies we use here at complex homeopathy, and it came up originally off of what part of your body?
Good question.
Kidneys?
Kidneys.
Yeah. Because she had chronic low back pain. Still, we're working through that, but it was just debilitating to the point where she couldn't lay flat or anything comfortably.
Or lift my children.
Or lift her children, yeah. It's kind of a challenge. We have 3 beautiful children. Therefore, we found that, and then H. pylori, Helicobacter pylori is the name of it, the common name. It really affects a lot of parts of the body, but kidneys and stomachs are very common areas. It decreases the acidity level in the stomach. It actually is very common when people are taking proton pump inhibitors as well as Tums and all the other antacids that people take because they have heartburn. The problem is people don't have too much acid, they have too little acid. And when the acid level gets low, then H. pylori becomes opportunistic. And then what it does is it actually takes advantage of that and creates almost like a smoke screen and then continues to keep the acid level in the stomach down, which perpetuates the issue with the low stomach acid. So when in doubt and you're thinking about stomach acid issues or heartburn, it's actually too little acid, not too much acid. We don't need to get too far into how stomach acid is super important for methylation in your liver and things like that, because it turns out that most oftentimes people, when they have gas and burping and stuff like that, it's usually pushed back from the liver and gallbladder due to the bile insufficiency in the small intestine. It hits the stomach and you get the whole 9 yards, okay? That's my nerdy side. You don't need to know about that. So what we're going to do is we're going to show you how we would evaluate this particular case and how we would approach it in a general sense. I don't know exactly what we're getting into. I do know from just quick screening her beforehand that her diaphragm is tight, so we'll show you how that is affecting people. But if I can show a picture, depending on how well it'll show up. But if you've ever seen, is that good enough, Amelia?
Mm-hmm.
All right. So this is the diaphragm, and on this diagram, there's a couple holes here. This half of inner tube is the diaphragm. So you have an aorta coming down there and an esophagus coming down there. So as you put food in your mouth, it goes down the tube, and what happens is, which way does this go? It looks like this now. So the stomach here, some of the stomach can get stuck up on top of the diaphragm, which then causes what's called a sliding hiatus hernia or a hiatal hernia. Not like the hernia people get in their groin or in other parts of their anatomy, but part of the stomach gets stuck up top when the diaphragm gets super tight. Well, right now we know Melissa has a tight diaphragm, but what we want to understand is where's the position of the stomach. So we can reduce that if we need to via what's called it kind of sounds rough, but visceral manipulation. But it's really just moving the tissue around, all right? So it gives you an idea of what we're looking at here. All right, so why don't you go ahead and just have a seat right here. And you can face them. Just put your feet on the plate here. It'll be easy for you. Okay. Now, for those of you who are uninitiated to muscle testing, or we call it biofeedback testing, basically it's a stress test, and therefore we can use any muscle in your body because it's just a feedback mechanism. The way I liken it is if I want to put something on the screen here and I type a bunch of buttons on the keyboard, it's going to show up on the screen. So if I challenge a tissue on her body and it changes a strong muscle to a weak, whether it's arm, hand, leg, whatever it might be, that's just a way of getting feedback. So what we'll do is I'll do my best to show you here. We take the strongest fingers on the hand, which is the middle of the finger and the thumb, and I have her use her monster grip, so hold nice and strong. Okay, so super strong. Now I'll have you take a deep breath in and hold it, and we test again. Stay strong, deep breath out. And then we'll test here. And the sheer fact that she's breathing is causing stress in her nervous system. So if you're not able to see that, basically what happens is enough stress happens in the diaphragm and the breathing that it short circuits it and these muscles become weak rather than staying strong when she's normally doing other things, okay? But breathing is a pretty important part of your day. You can only go about 3 minutes without breathing, unless you're a skin diver who's trained for 5, 10, 15 minutes underwater, but it doesn't really matter. Melissa's not a skin diver. Okay, so what we'll do is we're going to evaluate a couple more things that are usually tied into this. We'll check for some information depending on the side of her body that might be more affected. So for example, do you have more pain on one side of the body than another? Not currently.
Not
Okay.
currently.
Typically you do.
Yeah.
Okay.
Yeah.
Usually one side's flared up more than the other.
Yeah.
Okay. I think I said the left so is, but we'll check anyway. So what I'll have you do is lie on your back. Okay. And then I'll make the table your length. Oh, as soon as I turn the machine on. Safety first for all those little kids that play around the table. And here we go. Good. Fantastic. You're getting a bird's eye view. I can leave it on now for what people are experiencing when they're in the clinic. All right. So, Billy, why don't you come on in here and take a peek? So, maybe right over here. That'd be great. So what we're going to do, we already know the diaphragm's tight, so that's messing up her entire midsection. And therefore, I want to see if there's any other issues with her whole body, okay? Because if there's an issue in the central part of the body, it can affect the global parts, okay? So what we'll do is we'll just test some muscles on her legs. I'll have you push your leg down on the table. Good. I'll have you push your leg down on the table, okay? Now, for those of you who can't see that, I don't know how hard you feel like you're trying.
A lot.
Okay, push your left leg down, nice and strong. Push your right leg down, and you got nothing, okay? So we can test some other muscles. That's the extensor muscle. You can push your leg out to the side. Good, up in the corner. Boom, good. So bring your leg out to the side. You're going to hold out there, and she's got nothing, okay? So that is an example of what's called a hemisphericity in functional neurology. You don't need to get too nerdy on it, but what's happening is the blood vessels are all constricted on the right side of her body. Her right shoulder is being pulled in. Her right hip is being pulled out. So it's torquing her body, which can cause a lot of chronic pain. So we'll get to the stomach in a second, but this is more of a global issue. So what we're going to do is use a pair of eye lights here. For those of you who don't know how eye lights are, we're stimulating a specific brain part of her. We're going to stimulate the medial cortex or medial eye on the right and the lateral on the left. So I'm going to have you put those on. What that's doing is that's stimulating the left motor cortex, which is controlling all the muscle function on her right side of her body, in case you're wondering. Okay, so what we'll do is, so that hip is high, so she's got too much tension on this side of her body. So what we do is just rest that on my shoulder, and we're going to place the hand on the hip, and we're just going to rock the hip. Take a nice deep breath in. Good. And out. Good. Let that relax. Okay, so now we're going to do a fast stretch on the hamstring, so let this leg relax. There we go. Make you a little taller there. Let this arm relax, nice and loose. So we're doing functional neurology where we're doing fast stretches on certain parts of the muscles, and then we're doing on the extensors and the flexors. Pardon me. I'm going to go to this side. We're going to bend this guy. We're going to go 1, 2, 3, fast stretch there. Let this one relax. There we go. So for those of you who have any training in functional neurology, you might have an understanding of what I'm doing, but needless to say, we don't need to get nerdy on it. So push your leg down on the table, and now she's super strong, back to the Wonder Woman she is before. Okay, that's good. Now I'm going to have you push both legs down. Okay? And so push with your left leg down, strong, right leg down, strong, push them both down, and she comes up like a rug off the floor. Okay? So that's where we're going to find some stress in the midsection. So bend your knees and just rest them there. And what we'll do is we'll go about resetting the tissue. Okay? So I pre-screened her a little bit just to get a sense of what was going on with her body, and this is a pattern that she has right now. Doesn't have to go on over and over, but what we're going to do is we're going to affect the body starts getting, when there's too much stress, it gets pulled. Like the bladder will drop and the stomach will get jammed up there. The diaphragm gets tight, which messes up a lot of different things. Okay, if that makes sense. So we're going to put pressure near the bladder. Okay, so all right. So take a deep breath in, and we're just tractioning the tissue upward. Okay, because when the bladder drops, we need to draw it back. Okay, we're just resetting things neurologically. So take a deep breath in, and out. Good, and it will be tender. And if you have to go potty, definitely a good idea to do this beforehand. Okay, I have a 2.5-year-old, so forgive me. I just say potty. Take a deep breath. There you go. Good. So now what we're going to do is we're going to work on the diaphragm. Okay. So I'm going to go under here. There we go. So we're going to, the diaphragm, so this is the rib cage. Diaphragm sits right under there. It's the breathing muscle. So of course we're going to engage breathing as we do this. And oftentimes this is very tender for people. So what I do is I'll kind of release the tissue in some way, shape, or form. Okay, is that tolerable?
Yep.
Okay, so take a deep breath in and out. Here we go. Good. And take a deep breath in and out. Good. So this, depending on the person, it can be very, very tender, depending on how long they've had it for, what they call it, the chronicity, how chronic it is. Deep breath in and out. Now, interestingly, Melissa had not had this before, or at least I couldn't recall last time she had it. But since she started focusing on the H. pylori, her body's kicking into gear. It's starting to heal things in places she had forgotten about or her immune system had forgotten about. In the event, in this case, it was her stomach. Okay. So now we're going to do our visceral manipulation, or moving the stomach around. So take a deep breath in and out. This can be pretty tender. Okay. Good. Take a deep breath in and out. Good. So each person's going to feel it a little differently. Good. All right. So generally speaking, I usually ask people on a scale of 0 to 10, 0 none pain, 10 the worst ever. How did that feel?
4 or 5.
Okay. Some people it'll be an 8 or 9. If we need to, we can modify things. Okay. Last thing we're going to do is bring your arms up. We're going to hold your arms together like this, nice and strong. Good. All right. Relax that. So now leg your legs flat, and then push both of your legs down. Okay. So now you're strong. Cool. So just generally speaking, the amount of tension people carry in their diaphragm and in their stomach and area like that is intense. Okay. Just as an example. People think of the diaphragm as like the glass ceiling for your emotions or things like that. So emotions are the language of the body, whereas thoughts are the language of the brain. So when we need to hold something down and not deal with it, we tighten up, we stop breathing, okay, which is going to affect all your circulation, things like that. So one good exercise you can do at home to practice your breathing, because everybody who's not born as a stress case is breathing like a baby does. They breathe into their bellies, okay? So they breathe out in their belly, and in what you don't want to do in a normal breath is like this. It's not helpful, okay? You're going to get a lot of stress in your neck using your secondary respiratory muscles and things like that. So what I instruct people to do is find the rib cage and place one hand right over the rib cage. And the objective is that all the movement happens below on the belly button and nothing happens on the sternum, okay? So Melissa's already clearly knows how to do this and has either practiced it. If that doesn't work for you, what you can do is place your hand over your belly button and the other one on your chest, for those of you who are not accustomed to feeling your body very much and sensing it. Then you can make sure no movement happens in the chest and it all happens in the belly, okay? So breathe in. As you can see, if hopefully the perspective there is good, all the movement is in the abdomen because the diaphragm is contracting, it's pushing all the intestines down, which causes the belly to rise. You don't want any movement up here. Now, if you're doing sprint intervals and things like that, it's kind of hard to breathe in your abdomen. You're going to have to breathe labored breathing. Okay, you can relax. So that's what we can do is just one last check I would do for someone in this condition. I would check like a psoas muscle. If you don't know what the psoas is, just happens we got the model here. So if this is a plastic model of a skeleton or a spine, if you will, the hip bones are here. And so if we bring it upright, this muscle here is called the psoas, P-S-O-A-S. And one of our participants loves to say, so as I was saying. A shout out to SD there. So you have the psoas and the iliacus. So it's the iliopsoas. Both of these come down here, and a lot of people will get snapping in their hip. So for example, would have been a good idea to show you beforehand, but testing the diaphragm, then testing the psoas and going back, because if the diaphragm's tight, it can tighten up this muscle, okay? Because the diaphragm comes in right about here at the T12, and it'll tighten this muscle, which will cause a lot of snapping and popping in the hip when this is tight. So if the diaphragm's tight, the psoas is going to be tight. So a lot of people with low back pain might not be breathing very well either. A lot of people with hip pain or snapping in the hip can be caused by a muscle that's just way, way deep in your abdomen, okay? Generally speaking, it's not very fun, okay? So that's a general reaction people are going to get. Okay, so for example, we'll test, this is now, they're both equal sides now. So what we can do is we can bring this leg up here and have you push up toward the ceiling. 5, 4, 3, 2, 1, and push up again. Good. So that side's nice and balanced. It holds up under stress. It's not weakening when it's being activated. We're going to bring this one over here. We're going to push up toward the ceiling. And that doesn't work at well. She's like, hey, what are we doing there? Okay, so we already know there's tenderness in there. What you need to understand about the psoas is it comes on the front of the spine from L1 to L5 to S1 and crosses over and goes on the inside. So down the spine, if you remember the model, it attaches on the inside of the lesser trochanter of the leg. So it's really important to understand your anatomy if you're going to be doing this kind of stuff. And so what you can do, you can either use some type of instrument assisted to stimulate the muscle. We use the vibrocussor or this crazy thing for trigenics and stuff like that. When in doubt, if you just don't have a machine, you use your hands. So we're just going to use some, this is called digital finger stimulation. So we're going to find the tendon. So this is called the inguinal canal. And if you raise your leg up like this, you'll feel the tendon pop out. Okay, it's right there. Okay, so what I'll have you do is raise your leg up like this, and then feel for the tendon. Okay. Okay, so you got it? Okay. So I'm going to put my hand there now that you found it. Okay, so what we're going to do is we're going to strengthen this. Okay, so we're going to start here. Your job is to exhale down and out like that. Okay. Yep. Take a deep breath in. Exhale and push down and out. Good. Deep breath in. Exhale. There you go. And this is not always the most ticklish thing in the world. Last one. Good. Okay, relax your hand. So now what we're going to do is we're going to go back and test. I want you to push your leg up toward the ceiling. And now I can stand on that. Push up again. Okay. So that's what we call myoneural medicine. It's called trigenics. It's a technique we use here at the clinic. You can change the tone on a muscle in an instant. Okay. So what I've just done there is connected her brain with her body and reset the tone on that muscle so it doesn't monkey up her entire system and her pelvis and her low back and everything like that. Okay. So that's just an example of a cross-check I would do as far as looking at the breathing, looking at the diaphragm, stomach position, bladder position, clavicles can get pulled in, shoulders and stuff like that, low back and hips can get tweaked and stuff like that. So rather than carrying on, this is just a great example of what might be affecting you if you have shortness of breath at common times, if you have chronic low back pain, if you have snapping or popping in your hips, if you have like a neurogenic bladder that tends to give you a lot of problems. If you have a challenge, there's a reason behind it. Okay, you didn't just wake up with it. Although people come in and say, "I woke up and my neck was sore," it doesn't work like that. So, given what I know of her history of her low back stuff, I'm not about to challenge her back. So, she's going to enjoy a ride, just like in the movie Young Frankenstein. Whee! All right. So, if you happen to be maimed, we have ways of making sure you don't get further maimed, getting up and down from a table. So, please give a round of applause for Melissa. All right. All right, guys, so that's this week's edition of Wednesday Wellness Minutes. Appreciate you coming in and joining us. We're going to try and do as many of these Watch Me Do videos as possible so you learn things about your own body and how they can be fixed. If you have ideas for Watch Me Do videos, please send them to us. I have an infinite number of that I could do, but we always want to do things that are more pertinent to you and your desires and your interests because, honestly, this is for you anyway. So, okay, I do this every day. These ladies help me out. They're the best team in the world. So what we need to understand is what you need to understand and what you need to learn. So appreciate you coming by, and we'll look forward to seeing you next week for the Wednesday Wellness Minutes.